when we seen there is a problem in the lateral epicondyle. Okay. So now we have to mobilize this case. How to mobilize? There are many ways, using the mulligan belt or using our own hand. Okay, using our own hand or self mobilization. So we'll discuss about all these three things. Mobilization by using manipulation belt, mobilization using hand, and mobilization how to teach the patient self-mobilization. So this technique which I am going to teach you, this is based on Mulligan experience. As we discussed about Mulligan, Mulligan, he is one of the this inventor of this technique. So here, can you come to this side? What happens? See this lateral epicondyle, when we talk about, this is a soft tissue problem. This is a soft tissue or hard tissue? Soft tissue. There is a tendon, especially the extensor carpi radialis brevis. That muscle, this tendon, it is getting inflamed. So after, then while it is thought to be that because of this tendon weakness or inflammation, there is a maltracking of the ulna. Maltracking means, suppose this is the joint, it is shifting. This tibia and radius and ulna, they are shifting. There is a maltracking of the ulna and radius. That's why this help, and it's tried to bring this joint to the proper area, and then you can see the result immediately. Okay. Now, think that there is a pain when we ask the patient to make grip. Okay, the pain in the pronation. Here, there is no pain in the grip, but when we pronate, this is we are saying, assume, think. Suppose patient comes to you, pain when he make grip and do the pronation. How to treat this condition? Now, to treat this condition, we have to use this belt, which we have talked about. This is called Mulligan belt. Okay, this belt we have discussed about have many advantages, many faida, many effective for this belt. So here, you take this belt, wrap around yourself, around your hip. Okay, it should not be here back, it should be around your hip. Okay. Here, so here, wrap around yourself. This is the pad. This is just to stabilize that. Now, just try to tie this one from here. Okay, now okay, so here this is the radius, this is the ulna, this is the ulna, this is the radius. Now we assume, we thinking that there is a pain in when the patient is making this grip and pronating the arm, the patient feeling pain. Now how to remove, how to manipulate this case? So we wrapped around, and here we stabilize with the right hand his femur, sorry, this humerus. Okay. Now we take it here, we give 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So this is called lateral glide. Because what happened, this is ulna, this is radius. So what we are giving lateral glide to the ulna. Okay? So we are giving lateral glide to the ulna. Just make sure that this is not stopping the elbow joint. So here we are stabilizing this one, and 1, 2, 3, 4. So the force should come from the hip. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. So this is called one set of lateral gliding of the ulna. Okay. So what we are doing, we are correcting the maltracking, which was laterally shifted. Okay. So here, and then same time, then ask the patient to make the grip. You see, no pain, or the pain is less. So that means the ulna, this ulna has shifted medially. Ulna has shifted medially. Okay, because there is inflammation in the lateral epicondyle. Inflammation here, weakness here. So this radius and ulna shifting medially. So what we have to do, we have to laterally glide, bring the joint to the normal side, and then ask the person to make a grip.
We can't do that without tape.
Yes, we'll discuss how to do with the hand. If you don't have this one, how to do that one, we'll discuss also. Okay?
Yes.
So this is when you have a belt, this is showing good results. But if you don't have a belt, then we have some other alternative to do that. So this was what we had to do in this case. Laterally glide of the ulna. Trying to bring the joint in the proper position and then ask the patient to make a grip.
Yes.
There is the pain reduced. So in the first sitting, if you give 3 set means 30 repetition.
Frequency.
Yeah. 1 set means 10 glide. 1, 2, 3, up to 10. And then relax. 1 more set. 10 gliding, lateral gliding of the ulna. Again. So that means we give 3 set.
The same time.
Just relax. 1 set, give it relax 1 or 2 minutes. Then again glide 10 this one. So we give 3 set in first visit.
Yes.
And then ask the patient to grip. It is miraculously the pain will go. Very effective. If you have a patient, I'm telling you, if you have a patient, try to bring here and I will manipulate this one. So it's very effective. This is done by when we have a Mulligan belt. Okay. Supposing, but what will be happen? After this one, the pain will go. Pain will go generally, but if it is remain in other sitting, it will improve. But what the problem will come, Shabab? Here, the problem will come. Now the patient will have pain while he is, okay, like this is good. In pronation,
Good.
is good grip.
Against.
But the problem when he bent, oh, there is a pain. There is a pain in the bending of elbow. So we treat this one. In some case, pain might come when the patient is flexing the elbow. So we have to have some alternative. We should treat that patient. Some complication might come when you are doing this mobilization with belt. It might come that the patient will have pain in the elbow flexion. How to treat this one? So again, using the same belt, what we do, we take this one. Now, what we have to do, we have to do lateral glide in 30 degree of elbow flexion. If there is a pain, if the patient is saying, I have a pain in flexion. هذا كويس. Then I manipulated, mobilized, grip good, pain less. But when I bend, now there should be some help. There should be some treatment. So for that, what we do, we again stabilize this one in 30 degree. First 30 degree, we give 2 sets. 2 set means 20 glides in 30 degree. So here, flexion 30 degree. Just now you can just make it this one. and ask here 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Now 60 degree. Another 2 glides in the 60 degree. Now we flex the 60 degree. 1, 2. Always stabilize the humerus so that when you're giving this one, it won't go like this. To stabilize the proximal end of the humerus, hold it from here. Then you give the lateral glide here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
In supination, doctor.
In supination now. Now we will do in supination. Now, last 90 degree, 2 more repetition. Now stabilize here, okay? We can stabilize from here or stabilize from here, but better to stabilize from down so that you have a proper grip. Now, 1, 2, so just take it, the picture from that we have to take it, we have to give force from the hip, from our back. 1, 2, 7, 8, 9, 10. Relax. So that means now when we ask the patient, do this gripping, pain has gone from the first manipulation. Now I mobilize in 30 degree, in 60 degree, 90 degree, and the patient say, okay, alhamdulillah, I'm very much fine. So this is when we are having belt, Munigal belt. Suppose you don't have it. Patient doesn't have the Mulligan belt. How to mobilize? In that case, now I don't have a belt, but I have to mobilize the patient. There is a tennis elbow.
There is no belt.
Yes. So my hand has to work.
Mobilization.
Here, bring the hand. Okay. Just bring this one in the 90 degree abduction. Okay. Now, here, here, Ishabab,
Yeah.
what I'm doing,
90 degree or 60 degree, I think so.
now what we can do, we can view in this.
Alna.
Yes. Here, this is Anna. So what we are doing here, lateral glide.
Lateral glide.
1,
10 times.
2, 3,
7.
4, 5, 7, 8, 9, 10. So that is
Without
by
belt.
using your own hand. Okay? You have it, your hand. Go to proximal to the ulna.
Yes.
Stabilize the lower end of this humerus. And now we can give
Lateral glide.
this in the pronation. If the patient have pain in flexion,